Welcome to Heart-Based Medicine's Insights podcast, featuring Dr. Deborah Rozman, PhD, President and CEO of HeartMath Incorporated. What is heart-based medicine?
Heart-based is based on an understanding that the heart is much more than a blood pump. That the heart and the qualities of the heart, love, care, compassion, kindness, that have been around forever in historical religions and belief systems and cultures, that is the foundation of coherence in the human system. And as people activate that, medical practitioners, it actually communicates energetically to patients and actually gives us more intuitive connection and synchronization with the patients so we can be more effective in how we treat them. So heart-based medicine is activating and integrating the qualities and intelligence and power of the heart into medicine.
How does a heart-based medicine approach differ from classical medical training?
Yes, but all the medical training is up here in your head. This brings it down to your heart, so you know intuitively what aspect of your training is most needed. You also have the compassion and connection and care that nurtures you and your patient, so you feel more fulfilled in that connectivity and why you went into the healing profession in the first place, out of that deep care and wanting to connect and wanting to help and serve. It activates the feeling and the fulfillment of that as you put your heart into it, listen to your heart, follow your heart, and have more heart-based approach, because you've got all the stuff upstairs. Now you want to integrate the heart into it so it becomes a rewarding practice.
What kinds of resistance to this approach have you encountered?
Tremendous resistances. Let's start with the resistances in oneself. You don't want to be the outlier, and so you have to deal with your own inner resistance. That can come up unless there's a group of you, or unless your culture, your CEO has sent you to HeartMath training, then you feel supported. And that's why we usually don't train unless the CEO or senior executive is behind this, because it's a culture change. And the other resistances are just the bureaucracy, all of them government requirements for Medicare, or the paperwork, or the medical records the hospital has to keep. All of that red tape just consumes a lot of time and energy. So there's a lot of burnout because of that. The resistances are more like, when am I going to have time to do this? Instead of realizing, take a minute here, take a minute there, you need it for your health. It's just habit, resistance of habit, resistance of mindset, because haven't been educated yet, and resistance of the red tape and bureaucracy. As a society, we've come to value the head at the expense of the heart. We've come to value the mind, even if it means stress and strain and lack of resilience. We've come to be so out of balance, thinking that is the ultimate intelligence, and that is the ultimate that we're going to have in healing. And we have created a bureaucracy. We've created untenable, unsustainable situation for doctors everywhere, and for patients in many situations. So it's gone to the extreme, because a lot of people and scientists think that we exist from the neck up, and the rest of it is just to support the neck up, not realizing that separates us and creates all sorts of anxiety and depression and cuts us off from the nurturing, the oil of the heart, the soothing of the feelings. And that is such a critical part of being creative, human, productive, and intelligent. So it's, pendulum swing. Before the Middle Ages, people were all about emotionalism, superstitions and beliefs, and there wasn't enough development of the mind. And then the mind got to be the focus and developed. And now it all needs to come together. We need the heart and mind.
Is a heart-based medicine approach a return to an older understanding, or is it new?
Both. We're both returning to the core values of the heart that have always been cherished. Love, care, compassion, appreciation, kindness, courage. And it's new, because now we have the development of the mind to understand why that's so important, and understand that the alignment of heart and mind is what access it, intuitive discernment. It's what gives the mind more capability. The mind is more capable and more enlightened and more attuned when it is aligned with the heart. And that is new, the combination of the two. Intellect, heart, care opens us up to something new that we haven't really accessed or been educated as a society. So you know why people even hear the term heart-based medicine, they go, yes. That immediate response is knowing that that is essential for healing. That's essential for quality of life, for fulfillment. It's essential for overcoming this epidemic of physician burnout, depression, suicide. It's being cut off from the heart and what the values and the connection of the heart. Not just conceptually that, oh, we should love and care, but the feelings. That is what gives the soul and the body nurturance. It has to start with people waking up and sensing this is where it needs to go. And then that will build, because it'll build automatically with what the foundation that's being laid, because everybody knows it's true. It's true in the heart, so it's inevitable.
But how can a heart-based medicine approach positively impact on a physician's work and life?
Well, you have to first educate her when she's not frazzled as to what the role of the heart is in the human system, which is what my talk was just about the last hour. And so once she understands the role of the heart and how it's not just a blood pump, but it's actually informing the brain and body, it's actually key to health and wellness, that it's actually communicates neurologically, energetically, hormonally. Once she understands its role and what happens when you're not connected, then has simple tools she can use or techniques while she's on the go to shift back to the heart, then she can do it. I mean, we're in hundreds of hospitals. HeartMath is being used by hundreds of trainers in hospitals and teaching it. We have 500 chief nurses in Stanford, Dignity, Kaiser, Cedars-Sinai, other hospital systems throughout the United States, St. John's, Ascension hospitals, I mean, it goes on, VA hospitals, who are actually teaching others, nurses and practitioners in the hospitals, how to shift to the heart, how to integrate the heart and mind, how to use it to de-stress in the moment and build resilience and prevent burnout, and how to really activate and nurture why they went into the healing professions. So it's very much hit the ground running. Not everybody knows about it yet, so it will be. And that's a huge part of heart-based medicine. I mean, HeartMath is a foundation of heart-based medicine. It's the math of the heart and how activating the heart and having heart-based living, heart-based medicine enhances outcomes.
But how did you come to this understanding?
Well, I'm a long-term meditator, but even since I was a child, I referenced my heart for direction. I didn't think of it that way, but I felt it that way. And I think a lot of us do. When we aren't sure which way to go, your grandmother says, go to your heart for an answer. That's not a metaphor. We connect with some deeper part of ourselves. And so when I began to teach Gestalt psychology classes, I'm a psychologist by background, and having been a meditator focused on the heart, to open the heart, to connect, to deepen my meditation, I actually had the idea of a person going through a stressful experience, to have them sit on a pillow and be their head, talking to their heart about the problem. And then I have them switch pillows and be their heart, talking to their head about the heart's view of the situation and how the heart felt. was like two different people. And so they'd go back and forth, and then they'd finally settle in the heart with an intuitive aha of a solution or a clear next step. And I witnessed this so many times that I was convinced the heart was accessing a deeper source of wisdom or intelligence. It just confirmed what my own experience. So when I share that story, people go, yeah, it's not foreign unless you're so cut off that you can't remember as a child when you listen to your heart. You know, you have to have a certain receptivity. I grew up in a family, this is before I got into heart math, of course, that had 8 first cousins and uncles who were doctors. Great uncles, 2 of my grandfather's brothers, uncles, both of my mother's brothers, their children. And it was all very head-based and a lot of ego, thinking you're God. You know, at that time the doctor was like that, so it gave a lot of ego gratification, and they were very caring and serving people anyway. But you wouldn't talk to them about this until they got so stressed out that they were willing to say, what do I do? Now, I had one great uncle who was our family physician, who already was there. He was the most compassionate, caring, loving. He was your epitome of how he talked, his voice of the compassionate doctor. And he's from the old school, but his 2 sons and relatives who are doctors got more into the whole other paradigm of the doctor know-it-all. And I don't fault them. It's what was the culture of that time. But nowadays, when the doctors are burning out, stressed out, getting sick themselves, so depressed they want to commit suicide, they're either going to start opening up to what else is there, or they will leave the planet. There's a choice. So one of the things that I've seen work the best is all the nurses who are taking heart math or getting certified as heart math certified trainers, or the alternative health movement where there's so many doctors going into integrative medicine, alternative medicine, or lifestyle medicine. These people know the importance of integrating the heart, mind, body together. And as they publish papers and show outcome data, then the ego or head-based docs look, look at that. Maybe I should try that for myself as well as my patients. Maybe I need some self-care. It opens up the possibility because you're speaking through the paradigm that they live in. And so you have to, if you care, you reach through those resistances to whatever it is that they're open to, and hopefully that will open more of their heart. The patient wouldn't say it. It's other nurses, it's other docs, it's their peers, or people they respect, or scientific papers they respect. That's what's going to open them up.
How does the heart-based medicine approach change the doctor-patient dynamic?
The dynamic changes the way right now the doctors are working with patients. Is it creates an energetic field of more rapport, of more openness. And you say to the patient, you have X, Y, Z, and the research showing that you need to manage your emotional reactions more. That'll help change the immune and hormonal response, and here's some methods to do it. So most patients, as patients, are very receptive to that. Because again, you're focusing on the data and the outcomes that the mind then say, okay, if the research is saying that, then I'll shift to my heart.
Does there have to be a crisis before we change our approach?
That is usually how it occurs. It doesn't have to be that way until society is more educated, but that is what finally we don't know what else to do. We go for that walk in the woods, walk on the beach, try to find that place instead of going direct to the heart, which is that place. Or we have some crisis, a health crisis, a relationship crisis, a spiritual crisis, and then we find that place. So we just try to help people say, hey, you can go there before all that happens. But usually Stress is what brings people to that deeper place of knowing.
How does a heart-based medicine approach get taught in medical institutions?
Well, you find where you have the opening. And there's a huge heart-based movement. It's not just John. I mean, you look at the integrative medicine, you look at, there's lots of publications on alternative medicine. They all know this. They all are open to this. You look at the American College of Lifestyle Medicine. There's thousands of people. You start with them. You partner with them. How is heart-based medicine different than what they're doing? You find your niche and you do something different than what they're doing so that we all are co-creating rather than duplicating efforts. I think that is the key. What does HeartMath bring that heart-based medicine doesn't have to reinvent? What does integrative medicine bring? What does each one of these in-depth systems with their following or their membership bring? And how do we curate that? Because it's all about heart-based practices that no one would say it's not, but how do we bring it together?
Are support systems vital to the success of a heart-based medicine approach?
Yeah, we are just starting to build community because there's platforms that make it effective, digital platforms, and among our certified health professionals so they can share best practices. We have also a HeartMath Connected Facebook community where people can talk and comment. We will be building community, which is kind of like tribes around interest areas for consumers who take HeartMath programs or training, who have common interest areas, whether it's collective meditation or parenting or whatever their particular interest area is. People want to share how they're applying the heart and HeartMath tools or other tools they find valuable to improving themselves and those areas. And so it'll be more of an organic process because if you start community too early, you put a lot of directory, for example. Nobody goes to it, so you've wasted all that time and money and energy. You really need to find out what kind of community wants to happen. And you start small and you let it grow through pull rather than push.
Is there a gender bias towards an openness for a heart-based medicine approach?
Well, I think women have, because of natural nurturing quality of motherhood, they have more of a tendency to immediately embrace this than men, by the way men are brought up. But effectiveness is all about inner male-female balance. We all have both in ours. So men are developing more nurturing qualities as being single parents or as society shifts. Women are developing more of the, and have been, more of the male qualities of manifestation. And you can get top-heavy male as a woman and then you're not fulfilled. You can get top-heavy female as a man and you're not fulfilled. So it's balance. But I think that most of our clients for many years were women, and now it's much more of a balance. Most of the hospitals, it's the nurses who embrace this, and the docs are later. That's just part of the shift happening in society, and will continue until there's that balance which opens up the full creative potential of each person. So I don't think it's that much about men and women anymore. It's about how open you are, how integrated your heart and mind is.
This has been a Heart-Based Medicine production. Thanks for listening.